You just forgot where you put your keys again. Or maybe you walked into a room and couldn't remember why you went in there. And now, in the back of your mind, there's this quiet fear. Is this just normal getting older, or is something actually wrong with my brain? Most doctors won't sit down and explain the difference to you. So today, I'm going to. Memory changes are one of the most confusing and scary things that happen as we get older, especially for women. And the reason it's so confusing is that normal age related memory loss and early dementia can look really similar on the surface. Both involve forgetting things, both feel frustrating, but they are not the same thing. And knowing the difference could change everything. By the end of this video, you're going to know exactly what signs to watch for, how to do a simple self check at home, and when it's time to stop waiting and actually talk to a doctor. Here's the problem. When most women start noticing memory slips in their 60s or 70s, they fall into one of two traps. The first trap is they panic. They forget one thing, convince themselves they have dementia, and spend months anxious and afraid, when actually, what they're experiencing is completely normal for their age. The second trap is the opposite. They brush it off. They say, "Oh, I've always been forgetful," or "This is just what getting old feels like." And they miss real warning signs that something more serious might be happening. What you actually need is a way to tell the difference, clearly, calmly, and without needing a medical degree. And here's the thing about women specifically. Research shows that women are at a higher risk for Alzheimer's disease than men. In fact, almost 2/3 of people living with Alzheimer's in the United States are women. Scientists are still figuring out exactly why, but hormonal changes and genetic factors all seem to play a role. That means this is not a topic you can afford to ignore, but it also doesn't mean you need to live in fear. Let's start with what normal memory loss actually looks like, because this is where most people get confused. As you get older, your brain naturally slows down in certain ways. The speed at which you process new information gets a bit slower. Your ability to pull up a word or a name quickly, what scientists sometimes call retrieval speed, takes longer than it used to. And things you haven't used or thought about in a while just don't stick around in your memory the way they did when you were younger. This is called age-related cognitive decline, and it is normal. It does not mean something is wrong. It just means your brain is older, just like the rest of your body. Here are some very common examples of normal memory slips in older women. You forget where you put your glasses or your phone. You walk into a room and momentarily forget why you went in there. You can't remember the name of someone you haven't seen in years. You blank on a word mid-sentence, but it comes back to you a few minutes later. You forget small things you were told, like what your friend said she needed at the store, especially if you were distracted when she told you. These kinds of things happen to almost everyone as they get older. And the important thing to notice here is that in all of these examples, you still know who you are, where you are, and what's going on around you. Now let's talk about what early dementia looks like, because this is where things start to feel different. Dementia is not just forgetting things more often. It's a change in how your brain works at a deeper level. Early dementia starts to affect things beyond just memory. It affects judgment, language, orientation, and the ability to do tasks you've done your whole life. Here are some signs that go beyond normal forgetting and could be early warning signs of dementia. You forget things that just happened, like a conversation you had this morning or an appointment you had last week, and you don't remember them. With early dementia, it often doesn't. You get confused about time or place, not just what day is it, confusion. We all have that sometimes, but confusion where you genuinely don't know what year it is, or you get lost in a neighborhood you've lived in for decades. You have trouble following conversations or following along with a TV show you used to enjoy, not because you're tired, but because it's hard to track what's happening. You struggle to do familiar tasks, things like making a recipe you've cooked 100 times, managing your finances, or following the steps of your normal morning routine. You notice changes in your mood or personality that don't feel like you, becoming more suspicious, more anxious, more withdrawn, or more easily upset, especially if the people closest to you are noticing it too. You misplace things in unusual ways. Everyone puts their keys in the wrong spot sometimes, but putting your keys in the refrigerator or finding something in a strange place and having no memory of putting it there, that's different. You have trouble with words in a new way, not just tip of the tongue moments, but stopping mid-sentence and not being able to finish, using wrong words without realizing it, or calling things by the wrong name consistently. Now, here's something really important I want you to understand. Having one or two of these things happen occasionally does not mean you have dementia. There can be many other reasons for these kinds of symptoms. Stress, sleep problems, depression, medication side effects, thyroid issues, vitamin B12 deficiency, and other conditions that are completely treatable. That's exactly why a self-check matters. Not to diagnose yourself, you can't do that, but to give yourself real information you can bring to a doctor. There are a few simple things you can do at home to get a clearer picture of what's going on with your memory. These aren't replacements for a medical evaluation, but they're a good starting point. Step 1. Start keeping a memory journal. This sounds simple, but it's incredibly useful. For 2 to 4 weeks, write down every time you notice a memory slip or a moment of confusion. Just a quick note. What happened, when, and what was going on around you? Were you tired? Stressed? Had you been sick? Were you distracted? The reason this matters is pattern recognition. 1 or 2 incidents a week that are linked to stress or poor sleep are very different from daily incidents happening even when you're well rested and calm. Step 2, ask someone you trust. This is hard, but important. Ask a spouse, an adult child, a close friend, someone who spends real time with you, if they've noticed anything. Not in a dramatic way, just, have you noticed me forgetting things more often? Has anything seemed different about me lately? The reason this matters is that early cognitive changes can sometimes be more obvious to the people around us than they are to us. Not because we're in denial, but because the brain is very good at compensating and filling in gaps. So from the inside, we might not notice what's visible from the outside. Step 3, try the self-administered SAGE test. This is an actual validated cognitive screening tool developed at The Ohio State University. It's designed for exactly this purpose, to be taken at home without a doctor present to screen for early cognitive changes. You can find it online by searching for SAGE Test Ohio State. The test takes about 10 to 15 minutes. It involves things like drawing a clock, answering simple questions, and doing some basic problem-solving tasks. You bring it to your doctor, who can score it and use it as part of a broader picture. Step 4, pay attention to the fear itself. Research has found that people in the early stages of dementia often don't realize something is wrong, a phenomenon called anosognosia, which just means lack of self-awareness about one's own cognitive changes. Meanwhile, people who are just experiencing normal age-related memory loss are often very aware of and worried about their forgetting. So if you're genuinely scared that something is wrong, that worry itself is actually a somewhat reassuring sign. People who are losing awareness of their own cognition tend not to seek help. They tend to not notice. The fact that you're paying attention is meaningful. That said, this is not a reason to stop there. Concern alone isn't a diagnosis in either direction. Step 5, know your family history. Genetics plays a real role in Alzheimer's risk, especially a gene variant called APOE4. If a parent or sibling has had Alzheimer's disease, your own risk is meaningfully higher. That doesn't mean it's your future, but it does mean you should be more proactive about getting assessed. Talk to your doctor about whether genetic testing is something worth considering for you. Some people are reading this list and feeling relieved. What they're experiencing sounds a lot more like normal aging. That's good, but don't let that feeling make you complacent. Getting a baseline cognitive assessment done at your doctor's office, even when everything seems fine, is genuinely valuable. It gives you a reference point for the future. Some people are watching this and feeling more concerned, and if that's you, please hear me when I say, go see your doctor. Not next month, soon. Here's what to actually say when you get there. Don't just say, I've been forgetting things. That's too vague. Instead, bring your memory journal. Tell your doctor specifically what you've been noticing, how often it happens, and whether the people around you have noticed anything. Ask for a proper cognitive screening, not just a brief chat, but an actual assessment. If you don't feel like your concerns are being taken seriously, it is completely okay and important to ask for a referral to a neurologist or a geriatrician. Early diagnosis of dementia changes what's possible. There are medications that can slow the progression of symptoms. There are lifestyle interventions, exercise, sleep, diet, cognitive stimulation that research consistently shows can help. And there are plans that can be made while the person still has full capacity to make them. Finding out early is not a worst-case scenario. Not finding out early is. Here's the thing I really want you to hold on to from everything in this video. Your brain is not the same at 70 as it was at 30, and that is okay. Some memory change is completely normal, and it does not mean your mind is falling apart. But there is a real and meaningful difference between normal aging and early dementia, and that difference comes down to function. Can you still manage your life? Do you still understand where and who you are? Are the changes you're experiencing things that slow you down slightly, or are they things that are starting to get in the way of your ability to take care of yourself and live your life? Normal aging slows things down. Dementia disrupts things. If you're not sure which one you're dealing with, that's not a reason to keep wondering on your own. That's a reason to get information, real information from a real evaluation, from someone who can actually look at your brain. The worst thing you can do is sit quietly with the fear and not act on it. Let me recap everything we covered. Normal age-related memory loss includes things like forgetting where you put something, blanking on names temporarily, or needing more time to learn new information. These happen occasionally, don't get in the way of daily function, and often come back with a reminder. Early dementia warning signs include forgetting things that just happened and not remembering them even when reminded, getting confused about time or place, struggling with familiar tasks, personality changes, and misplacing things in unusual ways. You can keep a memory journal for a few weeks, ask someone close to you if they've noticed anything, try the SAGE test at home, and pay attention to whether your symptoms are getting worse over time. If anything worries you, talk to your doctor and be specific about what you've been experiencing. Trust what you're noticing and then do something about it.